So I mobilized the rib on each side for 2 minutes. And now we have good spring mobility of the rib. And you made the comment that it felt like a deep old ache. Mm-hmm. Okay? Yeah. And here's T1 moving. And you also commented that when you get chiropractic adjustments to your neck, that feels good. But what else?
That it also just feels like that one area just is not addressed. It just feels like it's still not moving, even though above it is moving great. And
yeah. And I agree. And I think that it takes 2 minutes to move a first rib. I don't think the rib responds to adjustments. And I think T1 will not respond to efforts to gap that joint with the chiropractic adjustment in the presence of compressed rib joints. So let's have you stand up and then test extension of your neck.
I think that we did here. Yeah, and now like already I feel like I can do my upper thoracic. Like I feel like my neck extension was okay, but it felt pulled here. Like I couldn't, now I could just I could just go back.
Nice.
It feels really good. Yeah, it just feels articulating. It feels expressive.
Wonderful.
Yeah.
And then how is rotation?
And then, rotation feels really good. Usually if I get to here, it just feels like it doesn't, my neck is okay, but it just, nothing else wants to move. And right now I just feel like I can easily open up.
Very nice.
Yeah.
And I don't think the ribs are subluxed. And I don't buy that model. I think they just moved to end range and got stuck. You know?
Yeah.
Yeah. So I think that T1 was hyperflexed in your whiplash and the ribs moved posterolaterally to a normal range, but they didn't come back. You know, they just got stuck at the end of normal range of motion. So that should maintain itself, but I taught you to put a piece of 2 foot by 2 foot plywood on the bed.
Yep.
Lie on your back on the bed sideways, and then use a soft ball under the first rib and let your head extend off the bed, and then reach over with your opposite arm and push the acromion just lateral to the clavicle, and push that posterolaterally for 2 minutes. And I think if you do this once a day for a week and then do it once a week for a couple of weeks, it's going to stay. It's not going to go back.
I feel so tall.
You feel taller?
I do, yeah.
Well, take a walk down the hall and come back.
I feel very comfortable.
Nice.
Yeah. Feel good. Yeah.
How does it feel when you walk?
I just feel more upright.
Yeah.
And I feel more of an opening all the way through here. I feel like my whole shoulder girdle is in a better position.
Wonderful.
Whereas I often feel kind of stuck anterior, you know.
And that's exactly what I described, being stuck in flexion, that T1 was stuck in hyperflexion.
Now it just feels more open. It feels
Nice.
really nice.
It'll be a piece
And I
of...
can breathe a little better. It has a lighter breath in here.
Nice.
Yeah.
I should have sprung the manubrium, because I'll bet that was hypomobile. I'll bet your manubrium now elevates and moves forward with inspiration. Well, thanks for the case study. I appreciate the opportunity to post it.